I'm literally in the backyard, just like my dogs are running around. And if I turn, it's like, oh, okay, don't turn. What were you doing? Like, I'm trying to be aware of what I'm doing. I don't like to take drugs. I don't like to take medication. And the, last year I was taking over 20 pills a day. And with that, it was like opiates, muscle relaxers. And that scares me because being in the industry that I am, I used to have two jobs. I had to quit one because of my situation. I am a coach, a fitness instructor. I've been
Oh,
for
wow.
30.
Okay.
I've been for
Okay.
30 years, and I had to resign of that job because I couldn't do it anymore. The driving, the fact, even just coaching, showing what they're supposed to do and helping my clients, I was not doing well.
Yeah. Mm.
So yeah.
Mm. And throughout your day, are you dealing with any headaches or migraines?
Yes.
It,
And at the end of the day, it's more, I think it's probably after the whole day of computer and all the regular, normal, basic tasks here at home, it's like the pressure. And I explain this in a way so people understand what I'm feeling. It's like that pressure in your head, like when you go underwater, and that is a constant feeling.
like an average pain level with zero to 10 being, zero, no pain at all. 10 out of 10 being you need to go to the emergency room. What's your average pain level? Would you say throughout the days? Like, let's say like the last 7 days, where do you usually sit?
Um, in the last week, probably between 7 and 8, and
And
some
that's
days it's,
constant.
yes, it's got.
So you told me different obstacles and challenges that have ultimately prevented you from getting pain free. We talked about different solutions, and it ultimately feels like you haven't been able to find the root cause.
Mhm.
That you mentioned that a lot in the questions. Is there any other obstacles or challenges you feel that are preventing?
I mean, I have tried all, like whatever you can probably think of when it comes to gadgets that are out there, uh, specialists. I don't know, and
Mm,
stress definitely is a big probably factor of why. Because right now it's like, oh, I need to relax my shoulders and breathe, and I keep reminding that myself throughout the day, but I'm still in the same boat.
yeah.
We put in the notes, and the therapist told me, it's like, do you know the notes that he added to your file? And I'm like, what is that? Aggressive approach. So he got to the
Wow.
point where he put aggressive approach.
Wow.
So, oh, they did aggressive approach. I'm like, like no, I can't. Like,
Wow.
just the fact of me driving there, it's a challenge. Like getting there and doing all that, I I can't. Like if it was helping me, if I was actually seeing some result, and I'm not saying now because this is not going. I know I tried, and my doctor, every time that I go back, he is like, now what? Did you stop?
Oh,
Because every
wow.
time that I go, it's like, did you stop already? Because every time that I will go, he will be like, are you continuing with your second job? And I'm like, oh yeah, because it's my job, and it's just me. Like I need the money. And at this point, I gave it up. I'm like, I quit. So that like last time that I went to see him for a follow up, I'm like, and I gave up my job. I said, and I'm still here and I'm still in the same situation. So I don't know what to tell you. And his only answer, because the first thing that they ask me when I walk in is like, are you going to need a shot today? I'm like, no, I
Oh,
don't want
wow.
shots. I don't know. Like, please understand me. I don't want medications. I don't want shots. I don't want anything that is going to be like damaging my body more, because the shots don't do anything. Like
Mm.
nothing. Like they just give me more pain. So no. Physical therapy, yeah, it helped for a while, but after a while it was like go one day and wait another week to recover to be able to go again. Dry needling, oh my God, it got to the point where like I can't. And having to do the chiropractor and then PT, and then the doctor added dry needling. I'm like, oh no, like I I cannot do it all. My body can only take so much, and I have to be able to function at some moment to be able to do my other job. So right now, I'm like, nobody touches me. Nobody tells me more. Like I cannot imagine myself living the rest of my life like this. I I can't allow myself to be stuck where I'm at for the rest of my life. Whether it's 20 years, 10 years, 30 years, I don't know. But
Hmm.
I can't. I told you before, I'm always waiting for the other shoe to drop because I never believe that it's too good. I always think that it's too good to be true. I know when the first time that we talked, when I said my pain level was like on a 7 or 8, I mean, it was because it was a sharp pain. Right now,
Yeah.
I mean, 4 or 5, maybe.
So that's awesome. In about 7 to 10 days, we've taken you from 7 to 8 constant, down to 4 to 5, which is huge. And then how's the headaches been?
No headaches.
Oh, amazing.
Yeah, no headache. By the time I ended my day, normally, I would be like just probably throwing the mouse against the monitor because I had enough.
Yeah, yeah, yeah.
So, and I didn't find. So it's definitely a big improvement.
Amazing. Awesome.
Yes.
That's awesome. The last question is, what excites you most about the future?
Without having to stress out about how I'm going to wake up that day, or how am I going to be able to get through that class, or how many pills I'm going to have to take to be able to handle it. Because I don't remember when was the last time that I took ibuprofen. Like, and that was my to go. Like midday, I was like, yeah, maybe like 5 ibuprofens will be good today. I mean, I was to that point. I'm like, I can't do that to my liver. Like, I cannot do that to my kidneys. There's no way I can. But I do look forward to have a little bit of more like a normal life, because
Mm.
I was not. I feel like in my head it was more like I was embarrassed people to see me that way, because I was at my
Yeah.
lowest. I was at my lowest. So I in at some point during those 2.5 years, I kind of like accepted that I was gonna be like this for the rest of my life. But it was, I mean, I couldn't like understand why this was happening to me. And I think I was at my lowest point when I was like scrolling on Facebook, and I
Hmm.
saw your post like that. I was I was desperate. And it's bad to say it, that people, including me, you have to be at that level, like desperate, that you have tried everything under the sun to actually. And I was scared. Take another approach and see if it worked. So yeah, I was scared, but right now I cannot thank you enough because what I do right now, if I would have done it, like the type of workouts and exercises that I'm doing, if I would have done it back then, I wouldn't have been able to move for weeks because I was in such bad shape. So, I mean, right now I can jog, I can run, I definitely, even in the beginning when I started with you and before, of course, I have literally a trifold bed in my living room. And that's where I would lay down when work was slow or I needed a break. It was like, I need to lay down because I cannot for anything just continue to hold my head straight. I need to lay down. And I think that also didn't work very well. So now, I mean, there's days that I'm almost at the end of my work shift and I haven't even sat down. I mean, I keep moving and moving because that's when I go out. I mean, I actually look forward to going out and I don't think about, oh my God, what's going to happen when I'm driving and what's going to happen with my back and my neck. I just go. I put my music on and go. So I enjoy actually going out now. And I'm not like counting the minutes to get back home and lay down. So it's obviously a comfort zone where I was at. And I'm going to say, I'm feeling sorry for myself sometimes. That's kind of like that mindset can't come back. It's just not happening. And I
Hmm.
put that stress to the side and not stress for things that I can't really control. So
Mm.
I'm I am right now, my mentality is like, if I cannot change it, why worry about it? I mean, you just do
Yes.
whatever you need to do to be ready up to see what's gonna happen. So
Mm.
and
Yeah,
I
that's
and
it.
I've been taking that approach with a lot of things, and I can't do that. I have to take care of myself and let other people do
Yes.
their thing. So
Yeah.
need to care more about the things that I can control myself, which
Yes.
is myself.
Yes.
I can control how I
Yes.
react, what I say, what I do. So that's
Yes. Taking that proactive
hmm
approach. Headaches and migraines every day for 2 or 2.5 years, and now you're back to working out. You're on the brink of your passion, which is coaching others. How does it feel to finally return to what you love? And looking back over those 2 years, did you ever think that it was possible?
I prayed every night that this will happen because it is it was for me that I was so active and I was on the go all day long, and at any point that you saw me, I was doing stuff, whether it was working out or working here at home or cleaning or doing all my stuff. Uh, and I went from that to like literally being like laying down all day long. I never thought that I was gonna be able to do what I'm doing right now
Mm.
because
Yeah, you weren't
I
able to
know
drive, cook, clean, none of that
it
stuff,
was
right?
everything will cause me pain, and I now understand on the road or even when I'm out of town, I take like my routine with me. So I
Yes.
I have to, and I mean last a couple weeks ago that when I was gone is the longest that I've been gone, like 3 nights in a long time, and and I was fine. Where before one night come back and I was dead for a week. So definitely I can see my body is stronger and better shape that to be able to handle more stuff. Really, like for me, I will do it for the rest of my life. I mean,
Hmm.
you helped me to, I mean, you helped me to change my life completely. You literally did that like 180 on me, and I mean, always I will be appreciated of that because you are amazing. And as much as I can help, when people ask me, I definitely always giving them your link, giving them your name, because you helped me, and I know I felt helpless when I found you. So for that, I thank God that He put you in my path, and that